this, but allow me to introduce Associate Professor Cowan, sorry, my apologies. We have a Neil Cowan who's in an adjoining health service, so you have to forgive me for the mistake. Professor Cowan is an endocrinologist who's practiced at the Institute for more than 17 years. He oversees specialist diabetes clinics in Prahran and Footscray, a telehealth service that is run in conjunction with the Royal Flying Doctor Service in Mildura, and a specialist outreach service that Baker IDI provides to 11 rural and remote sites in Central Australia. Wow. Diabetes is a large health issue locally, and we appreciate Associate Professor Cowan's attending here today. And I've got some notes here, which was probably a device to make me actually go off into the data, but we actually... The obesity rates and overweight rates of men in Whittlesea, in these, my notes say around about 46%, which is pretty scary, but that would lead us into a lot of data. But I won't steal the words from Dr. Cowan, and I'd invite you to welcome Dr. Cowan to the stage.
Okay, well, thanks very much for this invitation. Pleasure to be here. And I want to talk to everyone today. I'm going to talk about diabetes and the issues around diabetes and the importance of managing diabetes and preventing diabetes. So probably you're aware diabetes is a big problem all around the world, and there's really an epidemic of diabetes. I'm mainly talking about type 2 diabetes. There's a couple of types of diabetes. Type 1 is really what we could call juvenile diabetes. It's more a disease that comes on in adolescents and young adults and involves insulin injections, and it's got nothing to do with lifestyle and obesity or anything. So I'm really talking about type 2 diabetes, which is by far the most common type of diabetes. And there is an epidemic of type 2 diabetes around the world. So we now have about 400 million people around the world with diabetes. Most of that's type 2, and it's everywhere. It's not just Australia. So in Australia, we have, in the adult population, probably nearly 1 in 10 people have diabetes, and probably 25% are on their way to getting diabetes. So it's an enormous problem. It's a growing problem. So why is this? Well, there's a couple of really important points. You probably know that type 2 diabetes is linked to obesity or being overweight and lifestyle, not exercising enough, all that sort of thing. So that's really important. So we know that around the world obesity rates are going up, and we live in a society where we have to drive the car and we don't walk very far and we eat too much. There's lots of fast food around, all that sort of thing. So that's really important. So that's one of the key messages, and I'm sure you're aware of that. The other thing I would just say, I want to bring it to people's attention that there are risk groups for diabetes, and it's a really important message that if you're in one of these risk groups, then you need to be aware of that. So really there are many ethnic groups around the world that are at very high risk, and so we're talking here about anyone pretty much is not Caucasian, Anglo-Saxon Caucasian. So we have, for example, we know a lot of the Asian nations have very high rates. China, India, a lot of the Southeast Asian populations very high. Middle Eastern populations very high rates. Central America, African Americans, and in Australia the Indigenous population are at extremely high risk. Now we don't know why that is, but we know that the rates of diabetes in these groups are high, and certainly we have in our Indigenous populations probably 3 or 4 times non-Indigenous rates. That's huge. I visit communities in Central Australia where diabetes rates are 30-40% and they're quite young, and we don't expect to see type 2 diabetes in people in their 20s and even teens and even younger. And I've got young type 2 patients out there. So I guess the message here is that, you know, we talk a lot about lifestyle and exercise, and that's tremendously important. And it's tremendously important to eat well and not be overweight and exercise, etc. But there are a lot of genetics in diabetes. So I think that, for example, we know that Kathy Freeman has type 2 diabetes. Now, Kathy Freeman has done nothing to deserve that. You know, she's one of our greatest athletes, and is really lean, and her lifestyle is terrific. So just to put it in perspective, I think if you're in a high-risk group, it's not all your fault. And I think that there's a lot of shame and blame in diabetes where people point the finger and say, well, if you ate properly, it would go away. I think that's really not true for a lot of people that I see. However, lifestyle factors, yes, important. So the sort of things that we talk about to prevent diabetes are keep your body weight in the normal range if you can, or at least keep it to a reasonable range. Exercise is important, and eating sensibly. So we know that things like soft drinks are bad, lots of sugary drinks. We know that high-fat foods are bad, so fat is a key player. So we're talking about, chips and fried foods and Kentucky Fried Chicken and takeaway foods. And I see a lot of businessmen who eat out a lot, and they don't necessarily drink any soft drinks at all, but they're eating out a lot, and they just, eating out is just a recipe for overeating and eating too much and eating too much fat. So these sort of things are important risk factors for developing type 2 diabetes. So if you are over the age of 40, you should all have had a screening for diabetes. Now, doesn't mean a blood test. What you can do is you can do what we call a paper-based test or an online test to look at your risk. So there's an Oz risk assessment tool that you can do, and it takes you 2 minutes, and you can see what your score is. And if you've got a high risk score, you then got to see your doctor for a blood test. So we diagnose diabetes on a blood test, and so you go and have a fasting blood test, and if your levels are high, you may have diabetes, or you may be on your way to having diabetes. Now, number one, diabetes is largely asymptomatic. So you can have diabetes and have no idea. It's a bit like cholesterol, completely no symptoms at all. You can get symptoms if you're really, really high. So if sugar levels get up to 15 or 20 or high levels, normal is between about 4 and 6, then you can get a bit thirsty and you can get tired, and you can pee a lot, go to the toilet a lot. But that's unusual. Usually most people that I see have absolutely no symptoms whatsoever. So you can have diabetes for 10 years and be completely unaware. So does it matter? Do we care? Why should we care? So diabetes causes damage. So high sugar levels cause damage to the body, and it's well known that we have it's linked to heart disease. So high sugars if you can imagine the body's full of these arteries that are like pipes, diabetes sort of rusts and clogs these arteries. So if the higher your sugar is, if you don't treat it, it's a bit like cholesterol, you get clogging and rusting of your arteries, and that can cause heart attacks. It can cause, if your arteries are in your neck and your head, it can cause stroke. And if the arteries are in your legs, then you can cause what we call vascular disease, and you can get amputation. So that's the big blood vessels. And the other thing it does is the tiny little blood vessels, the microscopic blood vessels in your kidneys and in your eyes and in your nerves. So you can clog those up, and you can get what we call kidney damage, kidney failure. So diabetes is responsible for a lot of the kidney failure that we see. It's responsible for blindness and bleeding in the eyes, and it's responsible for, again, problems with nerve damage and circulation problems in your feet, and many other issues. And sexual problems as well. So erection problems, again, are caused by this sort of damage to the arteries. So these are all issues that they come on over years and years and years. So you can have bleeding in the back of your eye and be completely unaware until the point in time when you have a major bleed and you lose vision suddenly. But, the 10 years before that, this can be going on, and it's really important to identify these things early. Similar with kidney disease, you can have kidneys that are functioning but sort of leaking protein, and you'll be completely unaware of that unless you have a proper test for it. And if that's not treated, and if you don't get on top of this early, you can end up on a kidney dialysis machine, and that's hard work and linked to early death. So you can see that it's a bit of a sinister condition, and the key is finding out you've got diabetes really early and treating it really aggressively. So I'm talking to not necessarily the elderly people, I'm talking to people who might be in their 40s or 50s or even 30s to have, if you're in a high-risk group, have a screening test and make sure that you haven't missed this, because it's one of these completely asymptomatic things. If you have diabetes for 10 years and it's been missed, you can end up with complications before you even know you've got diabetes. So that's important. So let's talk a bit about management, and the centrepiece of management of diabetes is, of course, lifestyle. So we talk about diet and exercise. So you would see a dietitian, you would see a diabetes educator, and you'd learn to monitor your blood sugar levels. So some people with diabetes need to prick their finger and test and see how their sugar levels are going on a day-to-day basis. And you need to, of course, go through your diet carefully, and you need to keep your weight reasonable and exercise, all those things. So that's the sort of centrepiece of type 2 diabetes management. Now, type 2 diabetes progresses. So when you get type 2 diabetes, it's often pretty easy to look after, and as it progresses, it gets worse and worse and worse. And so, unfortunately, and that's nothing much to do with anything you've done, it's just the way the disease progresses. So you can start off on just nothing for your diabetes, no tablets, no nothing, and just doing a great job. And then in 5 years' time, you may need some tablets to control your sugar levels. So the doctor might say you need to take these tablets every day and start testing your sugar. And then you might need more tablets, and then you might need even to go to injections of insulin or other injectable treatments that we have. So it progresses. So again, it's one of these things that, it's important to understand you haven't done anything necessarily to deserve the fact that your diabetes is getting worse. That's the way the disease just goes. So, again, diabetes has different stages, and so you might have a very early stage of the condition in which your blood sugars are fine and very easy to control, or you may have a late stage of the condition when you need 2 or 3 injections of insulin per day, and it's really hard to control. And so we are constantly on the lookout for better and better therapies for diabetes. So I'll talk a little bit about some of the treatments that we have. So there are things we call oral agents or tablets for diabetes, and there's something called metformin, which is a standard tablet that we use that lowers blood sugar, and there's another group of tablets called the sulfonylurea tablets, and these are tablets that you can often combine with metformin. But there are some nice new medications out now that some of them are quite good for controlling sugar without many side effects, and there's even a new tablet out which is good for controlling diabetes, and you lose weight with it. So there's a couple of brands of new tablets that have been shown to be highly effective. And then there's injectable agents. So there's these new injections that you can take twice a day that actually control your sugar, and you can lose weight with those as well. So these are also, there's one called Byetta. I don't know if any of you have heard of Byetta. It's a twice-a-day injection that you take, and reduces your appetite, and it also lowers your sugar level, and it's quite effective in controlling diabetes. And you can combine all of these things in various ways to control your sugar levels. And then, of course, there's insulin injections, and a lot of people progress over 10, 15 years to needing insulin injections. A lot of people worry about insulin. You've probably heard all sorts of nightmare stories about insulin, and it's probably pretty daunting for most of you to imagine injecting yourself every day with something. But to be honest, these days it's very simple, and they come in these little pens, and you just dial your dose and jab yourself, and the needles are really tiny. So these injections are not so difficult, and of course we've got many people nowadays who probably 20-30% of the people I see with diabetes are on injections. So it's pretty common, so it shouldn't be a terrible fear. But I think the one thing with all of this is to make sure that you get your sugar levels controlled. So when you see a doctor, the doctor will order various tests that will measure your sugar, and there's a special test you can do that measures, if you like, the average sugar over the past 3 months, and the doctor should do that at least twice a year, maybe more, and that will tell you how you're going. Now, that average figure is meant to be less than 7%. That's the sort of magic number. So if you've got diabetes, we're trying to get you down to that level, which we can mostly do, but it's really important that we control you early in your disease. So if you are, if you're a young type 2 patient, let's say, when I say young, I mean, 40, 30, 50, maybe even 60, and you haven't got any complications of diabetes, they're the ones that need to be treated aggressively before you get sick. It's really not that helpful once you've started to get heart attacks and heart failure and kidney failure. You probably sort of missed the major boat there in terms of preventing. So it's all about preventing complications and getting in early. And that's why I really would encourage all of you, if you haven't done it, to get tested, or if you have diabetes, to make sure you get all the tests for complications and you're having aggressive therapies. So I think it's really interesting that most people with type 2 diabetes view this as a fairly benign condition, and I'm really not going to change my lifestyle because it's all too hard. And I feel fine, thanks, Doc. The truth is that the outcomes from diabetes are pretty serious, and if you don't control things, the outlook for a patient with type 2 diabetes is as bad or worse as many cancers. And so people die from diabetes. It's not just even the complications, it's death. So over a 10-year period, your chances of dying from complications of diabetes are probably higher than the chances of dying from colon cancer or in a woman, breast cancer or prostate cancer. So it is a serious condition. It is really surprisingly asymptomatic, and many people unfortunately ignore it, or that it's hard to talk people into having aggressive treatments such as taking tablets every day, or injecting yourself every day, or not going down and take away every day and all that sort of thing. So I think that's probably a bit of a summary of what I would like to say. I don't know if anyone would like to ask any questions or have any queries about diabetes. So yeah. Type 2. That's all right. Shout.
I'm actually type 2 myself, and lately I've read a few reports about diabetes and type 2 diabetes. If for the want of a better word. That's better.
Yeah.
Yeah, I've heard a few reports about people not having type 2 diabetes, bleeding it, in other words. Yeah. Is that a fact or is it not?
So that's a good question. There's lots of talk about curing type 2 diabetes. The only time this is correct is if you have someone with severe obesity and they lose a huge amount of weight, and that can happen in the context of super diets, I guess, and losing 20 to 40 kilograms, and that's very difficult. Or perhaps someone who has something like lap banding procedures and or bypass surgery and weight loss surgery. Now that can happen, but for the most part, this is not true, and diabetes actually tends to get worse. So I know you hear a lot of this in the media, and I beat diabetes, and etc. You certainly can get what we call a remission if you lose a huge amount of weight. For most people, number one, it's extremely difficult to lose a huge amount of weight. I'm talking about 20 kilograms plus. It's nearly impossible to do that and keep it off. But some people manage, and that's very commendable. I have many people who actually don't even need to lose that amount of weight. So there's quite a lot of leaner type 2 patients that I see from Asian countries for example, in some parts of Japan or China or India, there's much leaner people, and they simply don't need to lose 20 kilos. They couldn't if they tried, but they're at pretty high risk. Similar to my Indigenous population, many of them are fairly lean type 2s as well. So I think it's one of these things that goes around in the media. A tiny percentage of people can get remission if they are extremely obese and had a horrific lifestyle beforehand. If they went to McDonald's every day and drank Coke and ate chips every day, then you certainly can get complete remission and for quite a long period of time. But for the most part, no. Yeah, for the most part, it's either still there or you're at high risk of it still being there. So I think it's a bit of a nonsense. And again, it's this sort of thing that I don't like, where there's people point the finger and say, look, if you only ate properly, you wouldn't have this. If you just got off your... most of that's just not true. It's just not true. And this shame and blame is a nonsense. I mean, I don't know if you realise that in cancer, a lot of cancers, people of course have sympathy for people with cancer, and there's no shame and blame in cancer, but a lot of cancers are associated with lifestyle. For example, smoking, obesity is associated with many cancers. So, but people don't point the finger and say, well, look, if you weren't overweight, I think it's similar with diabetes. There's no doubt that these things are a factor and you can improve them, but genetics and that sort of thing, if you're in a high-risk group, bad luck, and I think we have to understand that a lot of this is not your fault.
Hi, my question is, how can we lose weight if we want to reduce maybe 15 to 20 kilograms, maybe with some light exercises and in a short period of time?
Yeah, well, look, that's a really good question, and if I had the answer to that, I'd be a very rich man, I think. But I think that some people can, and most people can't, and so I think it depends a little bit of where your starting point is. So if your starting point is that your lifestyle is terrible, and as I say, you're eating out all the time, and you're eating and drinking and smoking and going to takeaways and dining out, then it's probably a bit easier. But if your lifestyle is already reasonably healthy, then it's much harder. I don't want to put you off, so exercise is good. Exercise is rarely on its own producing a huge amount of weight loss, but it's definitely good for you. Eating less, of course, smaller amounts is really important. And all of that in some people can produce 15, 20 kilograms, but in most people it really doesn't. So that's why we have a range of therapeutics now that are becoming more and more important for weight loss. So there's some new medications, and your doctor will know about these, for assisting people. So again, I think we're finding more and more that the lifestyle factors are important, but in most people they simply don't work to achieve the sort of weight loss to get down to what we call normal body weight. And that's why more and more I think we're going to see a whole range of medications for weight loss around the world. As I say, there's already a few new ones around that are very strong and pretty safe and work really, really well. And don't forget, a lot of people are genetically prone to being overweight and obese. If your parents are big, or if you're in a certain ethnic group, bad luck. You can blame them for your genetics. It's bad luck. If you come from a skinny family, terrific, good on you, good luck. I think there's a lot of this that is genetic. So really, again, you'll see you have these shows on television where they have massive weight loss and they exercise like mad and etc. And you can bet your life that 6 months later these people simply put it back on again, and weight regain is a big problem. So I don't want you to give up on lifestyle. I think it's really important, but give yourself a reasonable goal. So a goal of 5 kilograms is much more reasonable than a goal of 20 kilograms for most people. So if you can lose 5 kilograms, if you have diabetes or if you're prone to diabetes, it's a really important thing for the body. Even 5 kilograms is tremendously important in your health. But losing 20 is often a bit unrealistic. You literally have to starve yourself. It's very, very challenging to do that. So, I think be realistic about it. A lot of stuff on the internet and the television that makes everyone thinks that it's absolutely easy. It's just not. And the body's just not designed for weight loss, unfortunately. The body's very good at hanging on to weight, and if you put on weight, then it resets its weight as the next weight. So it's very hard to lose, unfortunately. That's the way it's designed.
Hi, my question is I know diabetes is genetic. My question is if one of the parent has diabetic problem and another doesn't have diabetic problem, how we can get to know that will it affect the kids or not?
Yeah, well, that's a good question. So we don't actually know what genes cause type 2 diabetes. So if only we did, it would be terrific. We think that there's probably many, many different genes, and it's not one gene, it's probably a whole range of genes. So there's nothing we can measure exactly from any parent or anything at the moment. So if you've got one parent with diabetes, then you're at increased risk. And if you've got diabetes, your kids are at increased risk. So that's all we can really say, and therefore you need to have testing done at an appropriate age. So for most people that's 40 onwards, but if you're in a high risk group, we even recommend a bit earlier than that you go and have a blood test. So for example, if you would have had, so a lot of women have gestational diabetes in pregnancy, they're a really high risk group that should be tested every couple of years for diabetes. So once the baby's born, you're a high risk group for getting diabetes. That's one of the really high risk groups. But certain ethnic groups, as I mentioned, Aboriginal and Torres Strait Islanders are really high risk, so they should be tested very early on. And again, if you've got a strong family history, go to your doctor and say, look, I want to have a diabetes test. There isn't any genetic test, unfortunately, at this stage.
Thank you so much, Associate Professor Neil Cohen, for your really important talk today.